Hi, welcome. Thanks so much for joining us for delivering a new diagnosis of autism to patients and families, a strengths-based approach for empowerment. I'm so grateful. I'm a child, adolescent, and adult psychiatrist with a group practice in Sarasota, Florida, Dr. Stacy Greeter. And this presentation is particularly important to me, both as a psychiatrist and as a human whose concept of myself as an autistic and ADHD individual has evolved over time from brokenness and inferiority to more acceptance and celebration of the strengths of my autistic and ADHD brain. And I want that for more people out there. Dr. Kimberly Rust is a late diagnosed autistic psychologist who works in private practice and teaches doctoral students in clinical psychology. She lives with her awesome husband and kids in Florida and is pretty nice unless you try to feed her onions. Let's not do that. Brooke Guerin is an ADHD and dyslexic licensed clinical social worker. She is the owner of Uniquely You Behavioral Health, a multidisciplinary neurodivergent affirming care practice located in Illinois, and Affirming Minds Coaching and Consulting, a company focused on creating inclusive workplaces. Dr. Heidi Wheeler is a clinical neuropsychologist at Asians Americans for Community Involvement in the San Jose, California area, specializing in trauma-informed evaluations of neurodivergent children, teens, and young adults, and is also the parent of two ADHDers and one PDAer. Dr. Jessica Hogan is an ADHD psychologist whose group practice specializes in autism and ADHD assessments in California and Minnesota. And she provides consultation on affirming assessments via her consulting company, The Divergent Clinician. Her special interests are autism and neuroaffirming care, like many of us here. And this presentation is quite fitting. She'll be the facilitator of our conversation today. Jess?
Thanks, Stacy. So first, let's talk about the neurodiversity paradigm. So according to Nick Walker, the neurodiversity paradigm is a way of looking at neurodiversity, believing that neurodiversity is natural and valuable to society because there's no one normal or healthy type of brain or mind. So let's quickly compare neurodiversity affirming care versus the deficit-based medical model that we were all trained in. In a nutshell, with the medical model, it is assumed that there is a normal way of being, and anything that diverges from this needs to be fixed. Oftentimes, the goal of therapy is to make the autist appear to be less autistic or to find a cure. Under the neurodiversity paradigm, however, diverse brain types are considered desirable and offer a benefit to society. And oftentimes, the goal of therapy is to help the autist be their most authentic self. So now Kim will share from both a parent and professional's perspective on how it feels to be on the receiving end of a diagnosis.
Hello. I want us to look at this video. So we'll move. Yep, there we go.
We're doing stunts. Oh. You did stunts. Boom.
I like hearing Kim's giggle too in this.
You did stunts. Boom.
All right. But then when Quinn was almost 3, we found ourselves in an evaluation where his diagnosis of autism was delivered from a deficit-based model. We received the message that our amazing son was somehow broken and wrong. We felt misunderstood as a family, like none of our good qualities were recognized. And we felt hopeless and then rushed out the door without any resources.
Now, contrast this with my own autism diagnosis at age 40, by the way, right? Rather late. Um, I felt free and seen, like coming home for the first time to have a place in the world. I'd been reading the wrong instruction manual for my brain and body, thinking I was busted, and I needed a different manual. So I learned to regulate my sensory system better. So that self-care for me isn't something like going to get a manicure, a sensory nightmare, by the way, but going deep into my special interests, mining all the available information I can find on a particular new topic in psychiatry, whatever I'm hyperfixated at the moment, and then turning it into a fantasy themed presentation, as we do. And I find cool autistic people like this to do presentations with an info dump about my special interest in psychiatry. Most importantly, I'm more effective as a psychiatrist because I stopped trying to be like a neurotypical doctor, knowing that I view the world through an autistic perspective. I have a deeper understanding of and ability to celebrate both my neurotypical and my autistic patients. And I felt guilty. I felt guilty and really humbled that I misunderstood what autism is for so long, and I had missed a diagnosis of autism in a lot of my patients over the years. So here I am, growing, trying to do better every day. I'm really grateful that my brain is good at being wrong. I'll explain. Being wrong is a gift. It's a good thing to be able to see a new perspective that we didn't see before when presented with new information that doesn't fit our assumptions and change our minds. As human beings, we can only ever see as far as our willingness to be wrong. So I look forward to being wrong over and over as my career progresses. And now I have a neurodiversity affirming perspective on myself. So, of course, my self esteem and self concept are just rainbows and butterflies, right? No. I mean, childhood wounds run deep. While my autism was a mystery, my ADHD was obvious to everyone from a very young age. That's me in the corner there, age 4 or 5. I'm dressed up as a cat for ballet shortly before I actually got kicked out of ballet for being too hyperactive and impulsive and not following directions. And I was also quite apraxic, so do not fear. This was not a great loss to the ballet world. It wasn't going to happen for me. Back then, the way my diagnosis of ADHD was explained to me is that your brain has a chemical imbalance. You gotta take this pill so that you can get the extra chemicals that your brain doesn't have, and it ain't gonna fix your brain, but it will help you be less annoying and more tolerable to everyone around you. And this is because your brain was probably underdeveloped because I was so premature as a baby. I imagined it was like my brain didn't cook long enough, like those runny, mushy scrambled eggs. So here I am, stuck with this undercooked chemically imbalanced brain fantasizing about what it would be like to be as good as the other kids with their fluffy, well organized, perfectly cooked brains, and trying so hard not to piss people off by intensely scrutinizing the minds of other people around me to figure out what they needed from me to avoid rejection. How I became a child psychiatrist, of course. So grace and compassion to everyone back in the 1980s doing their best to try to explain this diagnosis. But now in 2024, within a more affirming understanding of neurodivergence, we can do better.
So, when we talk about autistic identity development from a strengths based, neurodiversity affirming perspective, we recognize the unique resources and abilities that children and adults bring to their sense of self. For children, this might mean celebrating their passionate focus on specific interests and their unique ways of interacting with the world. Here's an example of my son and I a few years ago discussing what it means to be autistic.
Hi, my name is Nimmer. I'm in 4th grade and I have autism.
What are some things you know about autism, Nimmer?
There's many different types of it.
What is autism?
A disorder.
What's a disorder?
a problem and language and speech and skill and stuff.
Well, we've talked before that autism is a difference that some people have, right?
Yeah.
It means your brain is wired a little bit differently, and so you think in different ways. Sometimes that's helpful, right?
I guess.
Can you think of some ways that it might be helpful?
You can memorize more.
Yeah, you've memorized a lot of stuff, right?
Yeah.
Can you tell us some of the things that you've memorized?
So I've memorized almost the entire periodic table of elements.
That's amazing.
Every country in the world. Well, almost every country in the world.
Mm-hmm.
And I don't know much else. I don't know. I'm trying to think what else.
You also learned all the flags of those countries and all the capitals?
Yeah, but I don't remember all of them.
Do you know that you taught yourself to read when you were 2 years old?
I did.
Yeah, you did.
How? I want to know how.
Well, you memorized all the sounds that different letters make and even different letter combinations. It was pretty amazing.
Okay.
So you have a really incredible memory.
Thank you.
You're welcome.
Thank you.
If you could send one message to the parents of kids with autism, what would you want those parents to know?
That autism is nothing serious and nothing dangerous.
Okay.
So kids with autism are completely equal and not worth less or more.
All right, Nimmer, thanks for making this video.
You're welcome. Bye.
So you saw how in this video, as my son discusses autism as a disorder, without shaming him, I move the conversation from using the language of disorder to the language of difference and strengths that come along with his particular profile. That's not to say that we didn't also discuss the very real challenges associated with his profile that, well, unfortunately, we didn't have time to include here, but that there is a balanced dialogue of strengths and areas in need of support. The research shows that autistic adolescents whose parents talk to them openly about being autistic tend to have a more positive self-view, and that learning about their autism earlier in life is linked to better psychological outcomes in adulthood. For adults, autistic identity development often involves a journey of self-discovery and acceptance. Identifying as autistic means that a person has undergone the process of assuming an identity that they truly believe describes them. This process can take years and often begins with significant exploration even before a formal or informal diagnosis is applied. Many adults find that understanding and embracing their autistic identity allows them to connect with communities that celebrate neurodiversity, leverage their strengths, and advocate for the accommodations they need to thrive.
Hi, my
Hmm. Now I'm going to talk a little bit about the main differences in ways to conceptualize a deficit-based approach to assessment versus an affirming approach. In a deficit-based approach, you feel like you're in an unknown environment. Which way is up? You feel alone. Professionals often take on an expert role and make clients feel uninvolved and unheard, according to Perkins and all from 2018. And you can really feel scrutinized and like all of your flaws are magnified. One of my colleagues who went through an evaluation said, I just felt kind of gross after spending hours talking about my flaws. A meta-synthesis of 24 studies of adult autism diagnosis found, quote, poor experiences far outweighed data reflecting positive ones, particularly the impersonal, critical nature of the process. Also, a lack of self-report tools with neurodiversity affirming language is an ongoing problem. Now, a different metaphor to conceptualize a neurodiversity affirming assessment would be exploring a tide pool together. If you're exploring a tide pool together, you're engaging with the person as a collaborator rather than what Perkins and al. Called an authoritative expert. You're following the individual's lead. We can go to the next slide on where to look and what to focus on. As Naylor described in their 2023 qualitative study, they had 44 respondents who were all autistic, and 20 of them were professionals who identified with a neurodiversity affirming approach. They actually came up with a wonderful way of describing this approach, saying, do with, not to. You need to trust the person to show you their lived experience, and offer a culture of acceptance and be ready to believe the person's experience. This picture here, by the way, is a mama and baby sea otter in Elkhorn Slough in California. You need to expand the definition of normal and be attuned to individual needs. Individuals feel a reduced need to mask when experiencing neurodiversity affirming services. And therapeutic assessment sees psychological evaluations as a healing process and combines the use of reliable and valid assessment tools and techniques with the power of empathy. And in this process, the client is changed by the experience of being deeply seen and understood. But you really must know that you're a guest in this terrain if you're a non-autistic professional. And you should try to learn autistic social norms and styles to facilitate authentic cross-neurotype communication. And you need to remember that intersectionality is very crucial. And it's difficult because a lot of people who have intersectional identities, such as Black, autistic, Indigenous, cisgender, and other minorities, are often later diagnosed as autistic or not recognized as at all.
Speaking of intersectionality, when we talk about neurodiversity affirming approaches, it's all about celebrating neurological differences without pushing neurotypical norms. But how we do this can really vary depending on cultural context. For instance, in some cultures, family involvement and communal decision-making are key. So bringing family members into the therapeutic process can really help with understanding and support. On the flip side, other cultures might emphasize individual autonomy and privacy, so we focus more on personal empowerment and self-advocacy in that case. As we adapt our approaches to fit these cultural preferences, it's important to pay attention to language and communication styles because they can really make or break the therapeutic relationship. Different cultures express thoughts, emotions, and needs in their own unique ways. Some might prefer direct and clear communication, while others lean towards more indirect or nuanced methods. By understanding and respecting these differences, we can tailor our communication to match what our clients are comfortable with, using language that clicks with their cultural background and being mindful of important nonverbal cues. Throughout this process, it's essential to remain culturally humble and curious, always open to learning from our clients about their unique experiences and perspectives. By doing all this, we create a space where clients feel truly understood and respected, which builds trust and openness in assessment and therapy. This way, neurodiversity affirming practices are not just respectful and effective, but also genuinely connect with the client's cultural framework.
So let's not give the impression, as Heidi mentioned, that it's all about the patient as expert. It's more of a balancing act between empowering the patient as an investigator of their own mind and the expert on their own experiences, while instilling confidence in the mental health professional as expert to guide the investigation. And treatment is that way too, ideally. I kind of think of it as like two expert co-investigators teaming up. Maybe one has expertise on the terrain as a native to that planet, and the other, as a guest, may have some technology to offer to bring to the table that the other doesn't have.
So, like Kim, we also bring in elements of therapeutic assessment into our evaluation. So, starting with the goals of the evaluation and having clients be co creators of that beyond just, am I autistic? So, what does the client want to get out of this evaluation? What kinds of things do they want to learn about themselves? And not imposing your own goals on the evaluation for the client. So, one thing that you can do is to be transparent and offer little nuggets of feedback and discussion about certain concepts as you go throughout, which can be counter to how we were often trained, which for me was, you can't give any feedback or any impressions whatsoever until the very end when you drop a bomb on the client. So, it can feel a little bit weird, but when you do this and you're able to have that open dialogue and then really include the client in the process, it can create a sense of trust and allow them to feel safe throughout the process. So, for example, even including them in the interpretation process. So, my practicum students will ask all the time, like, oh my gosh, the client said this on the rating scales, but mom said this, and the friend said this, and how do we even make sense of this? And what does this mean? And we can avoid making assumptions and just ask the clients directly what they make of that. And one thing that we see very often is the autistic person answering questions in a certain way, and simply checking in with them about what they meant can avoid any harmful misdiagnoses or engaging in diagnostic overshadowing. Anecdotally, we often see wider discrepancies between reporters or even between measures from the autistic person themselves, more towards the beginning of the exploration of their autistic selves. So, overall, when clients understand what is happening, what they're being asked, and why, it reduces anxiety and it can increase the accuracy of the data you're collecting. One of my colleagues, Tawana Woolfolk, says, "You cannot unmask unless you neurocept safety." And the key that I always tell my supervisees is that the diagnosis, or not, should never be a surprise. There should have been conversations about this throughout the process. The assessment can be an intervention in and of itself, and that collaborative process can help clients feel empowered, seen, and it can be an emotionally corrective experience.
I want to highlight that these principles can sometimes look different in practice, depending on the settings and different systems we each have to work within. Regardless, though, the intent is always to honor each person's unique neurocognitive profile in all manners feasible. By embracing flexibility and a person centered approach, we can move towards a more inclusive and supportive system for all, no matter the setting and constraints we encounter.
So what strategies do you use to engage the client or the patient as a co-investigator?
Giving patients podcasts, books, maybe a Little Mermaid themed PowerPoint presentation that I did with Jess, asking them to take notes as they listen to the podcast and read the information, telling me what aspects of the autism diagnosis resonate with their experience and what aspects do not fit them. So I use the phrase, let's be curious about whatever together a lot to engage them in being curious about themselves.
Yeah, and as psychotherapists often encourage clients to explore their neurotype as a way of better understanding themselves and their unique experiences. This process involves guiding the client to reflect on the patterns in their thinking, behavior, emotional responses, and as Stacy said, introducing them to resources such as books, podcasts, or assessments. By fostering a curious and non judgmental approach, therapists can help clients identify those neurodivergent traits that they may have not previously recognized. Investigating one's neurotype can lead to greater self awareness, self acceptance, and ultimately a more effective strategies for navigating life's challenges in an affirming and empowering way. We walk alongside our clients during this time and acknowledging that clients may have mixed emotions ranging from curiosity to and relief to fear or uncertainty.
So I can't overstate enough how significant it is for a patient to receive a new diagnosis.
Curiosity you must have, ever mindful of your power over your patient, and humble of your knowledge you must be.
Mindful of your power over your patient and humble of your knowledge. Our words hold tremendous power. A wise supervisor I had in residency used to say to me, in psychiatry, your words are your scalpel. Always make the smallest cut.
So then, Stacy, how do you explain a new diagnosis of autism in ways that foster positive identity?
That's a good question, Jess. We're trying to do that every day. I like a lot of weird metaphors. One that people are often familiar with is an Apple computer versus a PC. Different operating systems functioning differently, and you don't try to operate an Apple like a PC. There are things that might be easier for their brain being autistic and harder for their brain being autistic. And I may engage the patient themselves in listing examples of the things that are harder for them and things that are easier for them. So fostering positive identity doesn't mean we call autism a superpower or attempt to sanitize real pain and struggle of being autistic. Um, it doesn't mean that we only talk about strengths. We can celebrate strengths and validate but it's both a blessing and a curse at the same time. It's not all rainbows and butterflies, but there are a lot of rainbow unicorns. That's me with my rocking horse, Anna. And I would spend 3 to 4 hours at a time rocking and rocking and rocking my favorite stim while daydreaming as a kid. I also disclose my own diagnosis of autism and ADHD selectively to cultivate that safety, to model self acceptance and provide hope for families. It's important to highlight thriving autistic role models and connect people to like autistic podcasters who can mirror and normalize their experience.
Yeah, so one thing that I will talk about in feedback sessions is autistic culture, the autistic community, and how they are here to welcome the client with open arms. So, autistic culture refers to the shared experiences, values, and ways of being of autistic people. And I'll use Matt Lowry's Legend of Autistica, the co host of the Autistic Culture podcast, to use in feedback with clients. So I got vetoed to use that in this talk because I would probably be sobbing as I read it to you or read you snippets. But basically, it is a story about questioning oppressive neurotypical norms and offering a path to authenticity and self acceptance where autistic people can break free from their masks, embrace their true nature, and live amongst their neurokin. Being in safe spaces with our neurokin where we can be unmasked and accepted is the ultimate antidote to shame. And this will then lead me to talk about building healthy relationships in line with our communication styles and preferences. Personally, it was shocking to me how safe and accepted I could feel with another group of autistic humans. It has been so healing for me personally, and I love being able to encourage clients to consider not always trying to fit the square peg into a round hole, so to speak, and trying to fit in where they don't feel that sense of belonging and maybe trying something different. Let's diverge a little more. So, how do we invite people into a neurodiversity affirmative perspective on autism, especially parents who are terrified, angry, or defensive?
Inviting them into a neurodiversity affirming perspective requires a very thoughtful and compassionate approach. The way we frame autism, as we've been discussing here, emphasizing strengths and potential rather than solely focusing on challenges, can significantly influence how individuals and families perceive and accept it. Using this approach and maintaining a warm tone tends to help mitigate unhelpful emotional reactions and fosters empowerment. When I have a sense that individuals or family members may be confused or question the diagnosis, I'll directly explain that arriving at a diagnosis is a collaborative process, and I'll proceed in a conversational approach. I've gone through the data and evidence that I've gathered that suggests a particular form of neurodivergence, like autism. I might then ask them about their feelings and what they already know about autism. This helps me identify where they need more support and information. Many people have preconceived notions or misinformation about autism, or just really unfamiliar with what being autistic means. So, by offering accurate and up to date information, we can help demystify neurodivergence, reducing fear and anxiety, and work toward helping them appreciate their unique combination of strengths and challenges. Another crucial point I want to make is addressing caregivers' support needs. Parents of autistic children often experience higher levels of stress. I won't, I won't get into being stretched thin as a parent, coordinating all of my kids' bazillion appointments with speech therapists, occupational therapists, learning specialists, and all the rest. Caregivers of autistic kids also face additional burdens like negative judgments, stigma, and financial strain, which would naturally produce greater levels of fear and defensiveness. It can be really overwhelming. So, recognizing and validating these challenges and providing support is really important for the support system.
So, another divergent question: how can we explain the need for psychiatric medication in an affirming way?
Kids are especially concerned about agency, autonomy, and authenticity. I cheeked and spit out my medication at times as a kid. And I remember I wanted to find out who the real me was without medication. Could I do it without medication? And this is common. Um, that's what happens when people call medication smart pills, or whenever someone messes up asking a kid, "Did you take your medicine today?" I often use the metaphor of a colorblind painter to give kids a lot of credit and emphasize their agency. So there's a colorblind painter who's pretty good at painting, and one day they get the special glasses that allows them to see colors, and suddenly their painting is much more complex and improved. Who gets the credit for the painting? Whose art is it? Um, it's important to emphasize that meds are a tool, but children are in charge of their choices. Stimulant meds, I say, make it possible for you to focus, but you always choose what you focus on and what you tune out on medicine. Medicine doesn't make that choice for you. Medicine doesn't do your homework for you. Medicine is there to enhance your agency and your ability to be your most authentic self, not to control you. So I say our goal is for you to be with when it's on other meds, for example, on antidepressants, our goal is for you to be your most authentic without depression weighing you down and have access to your full range of emotions instead of meds will make your mood better or the med will make you focus. And here in these examples, the medicine is makes change possible, but the patient gets credit and is completely responsible for the changes. Now Kim's going to talk some about self-diagnosis.
So diagnosis is, as Human put it, an art, not a science. Both formal diagnosis and self-diagnosis can be accurate and both can be inaccurate, which if you look at, the research, there's support for this. Naylor in 2023 had a qualitative study that indicated that neurodiversity affirming practices should include accepting self-diagnosis as valid. And Corzine and Roy talk about how individuals may have a protectiveness towards this piece of their constructed identity. Also, Corzine and Roy talk about some of the reasons for self-diagnosis. Why would people seek this out? Sense of belonging in a community, sense of identity, peer validation, being perceived as an expert on a particular condition, peer support around challenges related to diagnosis. And they bring up a really, really good point here, which I we included this quotation. The rising trend of self-diagnostic behavior via online mental health communities is a complex and nuanced topic that requires meticulous consideration from mental health professionals to appropriately address their potential risk without perpetuating further harm to vulnerable individuals. We cannot just dismiss self-diagnosis. If we want to remain relevant as a field, we need to listen to individuals. Balancing adherence to diagnostic criteria, which of course evolve over time, and listening with a very open mind and up-to-date understanding of autism and people's lived experience. I don't know if, a lot of professionals, not, be curious the percentage of professionals who have had an evaluation themselves, but I would just want to emphasize how vulnerable that process is. And, just even to pick up the phone to reach out to try to schedule something is very vulnerable. And the process itself is quite vulnerable. So I think we should be respectful towards people and really, really value that.
Yeah, agreed, Kim. So I'm self-identified autistic, and this took several years. It was not taken lightly. And of course, autism is and has been my special interest for many, many, many years. And it was my specialty like far before I realized that I was autistic. And yeah, I didn't just watch one TikTok video. And no one's doing that, by the way. No one's watching one TikTok video and saying, "Oh, I'm autistic," and then going with that. Um, so people ask me, like, well, are you ever going to get a formal assessment? And I'm not sure that there's really a point because I think I know myself so well. I'm low support needs, so I don't need access to, resources that assessments can often unlock for people. It's expensive. There are risks, very real risks to having an autism diagnosis in your medical chart. And you often risk being dismissed and infantilized by providers. So I don't think that I will. And what's really interesting to me is that the whole subject of self-identification and self-diagnosis is a really tender subject for a lot of fellow psychologists, which, on some level I get. It can feel like a challenge to, our expertise, all the many, many years and years and years of coursework and training in, assessment and diagnosis. And there's probably this underlying worry of, okay, like, will we still have a job if, a substantial number of people are self-identifying? And also, change can be really hard. With the rise of the neurodiversity paradigm, clients might seek affirmation of their experiences and identity rather than with a more clinical label. And our roles as the assessors are shifting in the field from gatekeeper to a supportive guide and collaborator in this diagnostic process for autism. So that brings me to another question, which is, what about an incorrect diagnosis that a family or a patient/client has become very attached to? Or what if they disagree with you about your diagnosis?
Happened before. Addressing a misdiagnosis that has become part of a person's identity, whether stemming from a formal or a self-diagnostic process, requires empathy and clear communication. It's important to validate their experiences and explain the reasons for the revised diagnosis with evidence and clarity. I'll usually spend extra time with them meticulously going over both the previous data and how that may have led to a particular diagnostic profile, and the new information that suggests a reconceptualization is needed. I try to acknowledge the emotional impact and plant the seeds for them to begin redefining their identity, focusing on their strengths and their resilience. I encourage them to speak freely about concerns and let them know that I'm always available for further informational sessions as needed to assist them through this change. I also offer resources and referrals to connect them with individuals who can also provide ongoing support.
And then what about when you've missed the diagnosis?
That never happens. So, um, I emphasize that the DSM-5 has these neat, clearly delineated categories, but human beings are complex. All diagnoses are at best educated hypotheses. Always embrace the possibility of being wrong, and sometimes we can be both right and wrong at the same time because psychiatry is really ambiguous. There's always different nuanced perspectives. Never hold too tightly to your ideas. Curiosity is the antidote to stagnation. I think the capacity to self-reflect, change your ideas, and then pivot in a new direction is vital to clinical work. And in psychiatry, when we are really open and vulnerable about errors, about flaws, we have the opportunity to model this for our patients to enhance their self-acceptance and self-compassion, and to model that um, you can have a very close relationship and disagree as well, and that can be healthy.
All right, thanks, Stacey. Let's move on to accommodations for adults. So, when talking with adults about accommodations, there are actually several different aspects to consider, and I like to think of them in three different categories. So, accommodations that we can give ourselves, regardless what anybody else does for you, advocating for accommodations and supports from loved ones, friends, etc., and then formal work or school accommodations. So, I'll address a few of each. So, self accommodations can include things like implementing daily routines and rituals, creating a sensory friendly environment based on your needs, having different kinds of fidgets and comfort items around, such as weighted blankets, snacks, etc. Accommodations that you can advocate for from loved ones and friends could be things like splitting up household responsibilities based on your support needs and your strengths, normalizing autistic communication preferences, such as not requiring eye contact during conversations, respecting info dumping, and not requiring a back and forth conversational style or small talk, normalizing having alone time and time for special interests, as well as parallel play activities. Like it could be things like painting with a partner, watching movies, playing Pokemon Go on a walk. It could also be normalizing safe foods and not pressuring the family member to eat outside of their comfort zone. And then finally, common helpful work accommodations are things like allowing for flexible schedules and remote work, allowing for and normalizing stimming, allowing for employees to have no interruption periods of hyperfocus. So, for example, maybe Monday afternoons are dedicated to working on a particular kind of tasks with no impromptu meetings, and then allowing for cameras off during Zoom meetings. So, Heidi, what accommodations do you most commonly recommend for children?
Well, just like for adults, there are accommodations at the personal level, accommodations and supports from loved ones, and formal school accommodations. So, at the personal level, I'll often recommend services that teach self advocacy skills and promote autonomy. This involves helping children understand their own needs and empowering them to communicate these needs effectively. I also recommend psychoeducation on social differences. This approach helps kids understand and appreciate their unique social perspectives while also learning to navigate social interactions in a way that feels authentic to them. As I was mentioning earlier, by educating children about neurodiversity and social differences, we support positive identity development and help them develop strategies to manage their own challenges. I also think it's important to emphasize personalized interventions that build on a child's unique strengths and interests to build confidence and joy in daily activities as well. For family involvement, which is crucial, I recommend providing caregivers with information about neurodiversity, which can help them better understand and support their child's unique needs, fostering a more inclusive and accepting home environment. I also emphasize the importance of family support to reduce stress and improve overall well being for the entire family, not just the child that we're working with. I recommend creating supportive and structured environments both at home and in educational settings. This can include sensory friendly accommodations, such as quiet spaces for children who are easily overwhelmed, or visual schedules to help with transitions and predictability. Lastly, I encourage schools and other institutions to adopt flexible policies that accommodate diverse needs. So, this might include individualized education program or IEP plans that are tailored to the child's specific profile and address any potential areas of academic need.
So then, how do you balance being strength-based with the need to get services and accommodations from non-affirming organizations and policies?
This can be a little tough. As a neuropsychologist, my main goal is to understand and honor each client's unique abilities while making sure they get the support they need, right? So, this means balancing a discussion of strengths with an acknowledgement of their needs. There's no inherent conflict between encouraging positive views of autism and recognizing the real challenges faced by autistic individuals and caregivers. Sometimes, though, we have to use non affirming language, like providing the medical diagnosis autism spectrum disorder, to access those support services. But when I'm talking directly with individuals and families, I focus on how autism uniquely manifests for that specific person and frame their needs within the context of their overall well being and potential. By keeping this balanced perspective, I can advocate for necessary services and accommodations while still promoting a strengths based neurodiversity affirming approach.
So, how do we connect people to autistic community, role models, and how do we help clients evaluate whether a group or organization is a good fit for them?
There are many ways that professionals and clients can examine if a resource is, in fact, neurodivergent. Some of those ways are by looking for clear and affirming language, such that respects the neurodivergent identities. So, autistic person versus person with autism, and really looking and ensuring that they are avoiding that pathologizing or language or focus on fixing neurodivergent traits. Plain language that is easy to understand without jargon or complex terminology. And the content should be accessible in different formats, whether that be text, video, or audio. We want to also look at the ways in which the resources is representing autism. We want to look for resources that are created by or in collaboration with neurodivergent individuals. One question that we can ask is, does this resource highlight lived experiences, strengths, and diverse perspectives? We are looking for resources that focus on developing skills, self advocacy, and embracing differences. It should avoid an overemphasis on deficits or challenges. A neurodiversity affirming resource should respect individual choice and prioritize consent in all approaches. A great question to ask is self determination highlighted as a core value? So these questions are really just the beginning of how you can find affirming resources. You can scan this QR code and you can find a website where you can explore a curated collection of websites, articles, toolkits, and organizations designed to provide affirming and inclusive support for neurodivergent individuals and those who care for them. So please keep in mind that this is in absolutely no way an inclusive resource list, but this is a resource that has been collected by everybody that is doing this presentation today. And so we have all had contact with everybody on this list. And we will continue to add to this as a resource as we come across more. And there is an email that if you know of a resource that you can email and we'll get.
Thanks, Brooke. So, as I've gone through this process myself, becoming more accepting of my autistic ADHD brain, and then the external process of helping patients and families become more accepting of their brains, I hope to see medical diagnosis continue to grow to become more affirming. Our words as clinicians and our attitudes toward diagnoses hold great power, and a neurodiversity affirming perspective has great potential for cultivating positive identity, self acceptance, and hope. So, may the force be with you.